Good morning, everyone. Scott Mabor here with your Medicare Missive from the pond for Monday, June 2nd. Glorious morning. Hope you all had a nice weekend. Let's see. I wanted to update you. Last week I did a video and it was about too many siblings spoiling the soup. There were 4 siblings and trying to determine what's best for their parents, and not everybody's on the same page and can't reach some of them, and so on and so forth. And ultimately I spoke to one of the brothers who basically said, just, what do we need to get this done? It needs to be done for June 1st. Told him what I needed. He said, great, go ahead and do it on my authorization. Here's the information you need, just move forward. So I just wanted to give an update to that. So on his, with his permission, he's got power of attorney for his parents. They are currently in an assisted living out of state, but they are still official Mass residents. So they do live in Massachusetts. They have a home in Massachusetts. They intend to go back to the home in Massachusetts. Whether or not that happens, I don't know. But Massachusetts is a guaranteed issue state with community pricing. So all of our supplements cost, let me rephrase that. The supplement from company A costs the same whether you're male or female, 65 or 85, smoker, not smoker, healthy, unhealthy, makes absolutely no difference. Everybody in Massachusetts, for a given policy at a given carrier, pays the exact same amount. There is no discrimination based on age, gender, tobacco, any of that stuff. New Hampshire, which is where they are, uses age-based pricing. So you pay the age, you pay a rate based on your age when you enroll. Well, both of these people are in their mid-80s. They've never been on Medicare before. The rate in out of state, out of Massachusetts, is huge because of their age. They're 20 years older than the typical enrollee, and they pay a big premium for that, hundreds of dollars a month, because of their age. Well, when I was talking to the son rather, and he said they are Massachusetts residents. The house is there, everything, all their paperwork lists Massachusetts. They're Massachusetts residents. Great, let's go with a Massachusetts policy and save, I think it was $600 a month. So it's a substantial savings. Might have been a bit higher than that, actually. It's a substantial savings, and it's just the difference between which state is their official residence, and as of now, their official residence is Massachusetts. So they could take advantage of that. We set up the drug plans using the pharmacy that they are currently using while they're at the assisted living. And it also works at the CVS when they come back to the house. But in the interim, I got an email on Friday saying that, on Thursday rather, the mother is in the hospital. So I don't know why I didn't get any details, but we set it up just in time because had she been on the company health plan that she was on, the employer plan, she'd have a ton of copays and perhaps a deductible. Now that she's on Medicare as of June 1st, and it was kind of a scramble to get the confirmation, now that she's on Medicare as of June 1st, she has no copays, no network, so wherever they've sent her, she's fine, and she has a $257 deductible, which will be reset in January, but it's a small deductible, it's no copays, it's no network, and this was all done on Tuesday or Wednesday of last week. I believe she went into the hospital on Thursday. The insurance plan kicked in June 1st, so that was, I believe, Sunday. So was a bit of a scramble, but it definitely was in their best interests, saves them a lot of money, saves the family a lot of money, saves the company a lot of money. It's always best if you have 87-year-olds on your health plan at a smallish company to remove them, even if it's if you're over 50, you can't. But if you're under 50, they shouldn't be on the group plan. And even if if the size of the company is over 50, they would be better off. The company would be better off. Everyone benefits. Let me know if you have any questions or comments. Happy to help. Have a great day, everyone. Enjoy. Stay safe.